So, I think we can now move on to the last lecture before lunch, which you really deserve. It's on phobic postural dizziness. And as you can see on the first slide, there is an ongoing debate about the terminology. And again, there's a committee on this type of dizziness. If you call it functional dizziness, you're totally right. I think this is one of the important terms. Psychogenic is not well appreciated in the US, so functional dizziness is fine. And there are some subtypes of functional dizziness. One is persistent perceived postural dizziness, triple PD. And there is another double PD, which was the first description, phobic postural dizziness. And we have not finalized the classification, but we will end up, I think, by the end of the year with a draft on this frequent type of vertigo and dizziness. And by the way, it's the most frequent type of dizziness in younger adults in many different countries. To get you an impression about it, please listen to these 4 patients. Do we have a sound? Maybe not. Let me check. We had a problem at the beginning. Can you increase the level, please? Oh, now it's better. Okay. So listen to this patient.
What complaints do you have?
I have a persistent postural vertigo.
Since when do you have these problems?
I have had them for approximately, well, let's start
What
again.
complaints do you have?
I have a persisting postural vertigo.
Since when do you have these problems?
I have had them for approximately 3 years.
Are there situations in which the vertigo becomes stronger?
In my opinion, it becomes stronger when I'm under stress, and what I've also noticed when among a lot of people, for example, in a pedestrian zone or such, then
Are there situations in which the vertigo is less?
it's less when I actively move around, for example, when I do sports, and yes, also under the influence of alcohol, it's less.
Is there anything that you avoid because of the vertigo?
There are definitely such situations that I have simply avoided, like any kind of mass of people, that I wouldn't do again.
If you had to describe your personality, how would you classify yourself?
Well, I'm a very exact person who is probably too introverted.
Thank you.
Okay, first patient, second patient. Mr. Johnson, what are your major complaints?
My complaints are lightheadedness, dizziness, vertigo.
When did the symptoms begin?
About 3 months ago.
Okay. Is this a permanent problem or does it occur in attacks?
First, I had attacks. Now it developed to be a permanent problem, like except for a few hours a day.
Mm-hmm. Are there any situations in which the symptoms are worse?
Yeah, when I have to go and see bigger crowds, like a shopping mall and things like that.
Any situations in which the symptoms become better?
They are better when I drink a little alcohol, but really just a little bit, or when I do sports, when I'm at home, or accompanied with someone.
Okay. Could you please describe your primary personality traits a little bit?
My primary personality is I'm a checker, so I like to control things, have them orderly, and kind of have a plan for the day and go through it.
Thank you very much, Mr. Johnson. So, number 3.
At the moment, my major complaints are dizziness, which I experience particularly in any situation where there's a lot of movement. So, for example, driving, being in a place where there are a lot of people, such as in a group of people where there are a lot of people talking, in a shopping centre, any place where there's a lot of movement that I have to watch and keep my eyes on. it makes me feel unsteady, disoriented, dizzy, nauseated, and it makes me lose my concentration. It happens almost every day. Along with that, I also experience a sense of imbalance when I'm walking. This is particularly also if I'm looking at things which are moving, or if I'm in a group of people while I'm walking, or in a place which is very busy. Yeah, they're the main complaints.
Okay. How did that begin?
The symptoms began approximately 2 years ago. I had a slight head injury. I walked into a pane of glass, and I injured my nose. I fractured my nose. And subsequently I developed all of these symptoms about 2 or 3 weeks later, along with some other symptoms, including tinnitus. And yeah.
Did you recognize any changes of your symptom after a small amount of alcohol?
Yes, I do. That's something that's very clear. Even half a glass of wine or a very small amount of alcohol almost always eliminates the symptoms completely.
Are there any things which you prevent to do now due to your dizziness?
I do avoid going to places which are very busy. If I can help it. I mean, I still do things which I have to do. However, I have reduced the amount of sport which I do. That's one thing which I have reduced quite a lot.
Okay, final question. Could you describe your primary personality?
I guess I'm a person who gets stressed quite easily. I'm quite a perfectionistic person. I like to do things right. I like to do things well. I like to make the right choices about things. And I guess I'm quite hardworking and quite an ambitious person.
Thank you, Ram. Okay, so I could show you another 20 videos. What is your impression? They're all pretty much the same. This means for your clinical practice, once you have first diagnosed your first patient with this functional dizziness, you will easily diagnose the next 30. So you just have to get a feeling about this very frequent disorder. And by the way, Sigmund Freud was the first one to describe that. He was really an ingenious man and a fabulous writer. He was also nominated for Nobel Prize, not for medicine, for literature, indeed. So, and this is his description. So he talked also, or he wrote about dizziness, and he says, it's not a rotatory vertigo, like in Meniere's disease. It's more a problem with coordination. Thus affected patients do not feel fine. They have the impression that the ground is moving, or that they fall into a deep hole without force. That's very important. And it's a chronic phenomenon. And he also describes here, right part, secondary phobic postural dizziness. Patients who had an attack of vertigo and then developed this phobia. So he was really the first one describing the features. And over the 100 years, the features are a little bit more specified. And these are the current criteria. So subjective instability with normal findings, or findings that cannot explain the symptoms. So you may well have a patient with multiple sclerosis who has phobic postural dizziness, or Parkinson's disease. The symptoms typically fluctuate, and they become worse in certain situations, like department stores, large crowds of people, a lot of visual flow also impairs the patients. And typically, the symptoms improve after small amounts of alcohol and also during sport. Alcohol means you do not check your balance as good as you normally do. Sports means you concentrate on something else. So a patient from Canada came to us. He earned a lot of money in the half pipe, but when he was waiting down at the ski lift, he felt enormously dizzy. And you can see the discrepancy. And what we recently find out, that patients have less symptoms in the early morning. And we did that for 3 different chronic vestibular disorders. One was phobic postural dizziness in blue, then in purple downbeat nystagmus, and in green bilateral vestibulopathy. So in downbeat nystagmus, patients have most symptoms in the morning. In bilateral vestibulopathy, they feel dizzy when they get out of bed, but it worsens during the day. But typically in phobic postural dizziness, the first minutes of the days are fine. You see that here with this well-known cat. I think it's the most famous cat in the world. So when he gets up, everything is fine. Slept well, bathroom is every fine, also fine, but after breakfast, then he feels dizzy. So that's a key question for the diagnosis, because if you have an organic disorder, you feel worse in the morning when you get up. But here it's completely different. By the way, that's the time the patient needs to move out their antennas to sense, oh, I'm dizzy. And the personality traits, as you saw on the videos, most of them are a little bit compulsive. Is anybody in the audience who is not a little bit compulsive? Can you raise your hand? Ah, there's one lady. Okay, but this is typical. So we all have a higher risk, including me, to develop phobic postural dizziness. Okay, here you see it in a typical German engineer, and he nicely described his different symptoms in different areas. So this is quite a perfectionist, and you see how detailed he managed that. That makes the diagnosis quite easy. It's also typical for these patients to come with a big folder of all the previous examinations. If you see a young man or lady moving in like that, you might diagnose phobic postural dizziness. So, and there's also a secondary type of phobic postural dizziness. These are the patients who had at the beginning vestibular neuritis, PPPV, or even worse, recurrent vestibular disorders. You find it more frequently in vestibular migraine, in Meniere's disease, and vestibular paroxysmal. So you should be aware of that. And it's also an issue in vestibular neuritis. Patients improve, and after 4 or 6 weeks, they develop new symptoms after vestibular neuritis. What are the two differential diagnoses? The patients who had a vestibular neuritis develop new symptoms. Phobic postural dizziness and post-infectious benign paroxysmal positioning vertigo. So these are the two entities you should be aware of. The mechanism, I found this painting many years ago in the Annals of the New York Academy of Sciences, and it depicts the basic problem, I think, quite nicely. What is this gentleman doing? He's standing on firm ground, but nevertheless, he's checking his balance, and that's the basic problem. And if everybody can develop phobic postural dizziness, you just have to concentrate on your balance. And the basic problem is, the balance is controlled via reflexes. And for a reflex, you need an error signal. And when you concentrate on that, you become aware of the error signal, and then you feel dizzy automatically. And there's another nice finding. We did a lot of posterography examinations in these patients, and if you have an easy task, simply standing there on the platform, compared to a more difficult task, standing on a full rubber platform, the more difficult the task, the better the balance. You see here, she needs help on the left side, but here it's much more difficult for her. She's standing perfectly stable. So that's typical. And another issue, we measured that here. So the more difficult the demands, the relatively better the balance performance. And the same is true for alcohol. This study came from Scandinavia. Nevertheless, as you see here, they use Bavarian beer. You see here typical Bavarians on the left side. So after half a liter, after 1 liter it's worsening, but after half a liter, you feel less dizzy. And this is something you can measure by posterography, and you do not concentrate on your balance as well as you normally do. So, what about the treatment? This is what counts. First, you have to be familiar with the entity, and you have to convince your patient that he or she is suffering from this frequent disorder, which is quite easy because clinical experience shows most of the patients already know what their problem is. They just need to find a doctor who agrees with him or her. That's the point. So, 4 steps. Complete diagnostic workup. Most often easy because they have 2 MRIs of the brain, 2 of the cervical spine, all the examinations you need. Just complete that. Exclude bilateral vestibulopathy. Then explain the mechanism. Permanent checking of balance. Then the patient should expose themselves to every situation which makes his or her symptoms worse. Go to department stores, go shopping, whatever you like, and regular sports. And in particular male patients, they need antidepressants because they often have anxiety. So you can give them fluvoxamine. Very few patients need psychotherapy. And then the success rate is remarkably high. It's 70%. So, a very frequent disorder you should be familiar with, and then you can easily treat your patients. Okay, to summarize that, most common cause of vertigo in middle-aged adults, postural dizziness with subjective instability, normal findings, worsening in certain situations, avoidance behavior, posturopathy, the more difficult the demand, the better the balance performance, therapy, successful psychoeducational therapy, combined with the behavioral or pharmacological therapy. So, final question. Who of you is interested in football? Who not? Okay, who was the last World Championship? I have a recommendation for your team. This is the first half. So Mexico is playing up there, and that's the second half. Mexico is playing up there. So good luck for the next World Championship in Russia. Okay, thank you very much.